Check.
Mate.
What's the question again?
You let me introduce the question.
Okay. All right, sir.
You let me worry about that.
Ready? What's going on, guys? Welcome back to the PT Coffee Cast, brought to you by The Movement. My name is Dalton, and alongside me today is my beautifully bearded friend, William. William, how are we doing today?
I'm doing good, and you know what, Dalton? I noticed something.
No what?
I noticed that you have some beautiful socks on.
My avocado socks?
Those have to be my favorite socks.
Yeah. I don't know where the whole avocado movement came from, but it's here. It's been here.
I think it's a fun food.
Yeah, I mean, it's high in nutritional value. Get a little good fats in you.
Throw it together with some other things, make some guacamole.
You can put it on your socks.
Kids can eat it. Adults can eat it. It's fun for the whole family.
It's versatile.
It's very versatile.
Well, I'm glad that you like my socks, man. I'm always trying to bring out some joy through my socks, you know?
Yeah, I really appreciate how this transition into cold weather
Yeah.
really brings out your sock game.
And it makes me just feel cozy, you know?
Yeah.
Like there's no skin exposed. It's just there's a nice sock there to the pant. Yeah. That's not cozy.
It's not. I wish it was. I wish I had better socks.
You need some avocado socks. But yeah, I'm super stoked that we're back, guys. We're pumped to have you. We are continuing on with our clinical questions series. This is going to be the final drip of the series. We made it. This is our 5th episode talking about some of our favorite clinical questions. So if you haven't checked out the other four episodes, you should head over to the podcast platform, whether that be Apple Podcasts, Spotify, or wherever you're listening, and check those out. You can also see all those episodes in our beautiful faces in my socks and Will's ankles on the YouTube channel where we put out all the video episodes. So you guys can subscribe there so you don't miss out on any of those. And then we have our website up and running that has all of our episodes there as well. And we have some content there for you guys. We have our PDF that we've created about how you can have a silky smooth game plan for your clients. You can download that for free on the website. And then we have the opportunity for you guys to do a little call to learn more about the mentorship and how you can become part of the next cohort for the movement mentorship. So super stoked about all that stuff. And we are excited to be on the final question of the series. And I will pass it over to my beautifully bearded friend, William, to lay out the question for you guys.
Okay, so this question is, if we had the power to do so, and we could remove your pain right now, how would your life be different?
Yeah, it's a great question.
And that's what it is.
It's a powerful question.
You like it?
I do.
Have you used that before?
I have used that before. I used to use it quite frequently, and I haven't done it in a while. I haven't used it in a while, just more forgetting about it. I oftentimes will use that question, or I'm triggered to use that question more when it's someone who's really acute and really avoiding and not doing things and pretty upset about it. Where I tend to remind myself to ask that question.
Yeah, similarly, I find I use it when I'm maybe trying to get a little bit more motivation from the client, not motivating them, but understanding where we can get some motivation. If someone tells me, I don't really know why I want to have no pain other than just not having pain. If it's hard to figure out,
they haven't really given you anything as to their goals or what they want to get back to. It's kind of just I don't want to have any pain.
Yeah. If they're very focused on their pain, and not that that's a bad thing, but it's also good to know more than that.
Yeah, it's a good way to ask the goal question in a different way without actually directly asking it.
Because I find it just when you ask someone like, why do you want to have no pain, it's just like too vague sometimes. Whereas that gets them thinking about their life and maybe what's been missing. Because if you're so focused on the pain that you've been having, especially if you've been having it for like 2 or 3 years, it's sometimes hard to even imagine because you've been in that state for so long.
Right. Yeah. So what typically happens with that question? Like, what routes pop up for you, and what are like the follow-up things that occur based off that question? Like, what are you really trying to get out of it? I think you just talked a bit about maybe trying to pull some goals out of someone who doesn't necessarily directly see any goals and their only focus is getting out of pain. But is there any other reasons that you ask that, or you're trying to get things out of with that question?
I think I'm just trying to like plant the seed more than anything, because assuming we can actually improve the state of things, like there gets to be a point where you can now start thinking of that stuff. And I think more than anything, it like encourages a bit of excitement with it too, because it's like, oh, like I think it's better to be striving for new things and new possibility versus striving on removing your pain. It's a motivating factor to get you in the door, but to like actually elevate your life, I think you have to move from that. And so like it's planting the seed, and then that way, like when we get to where like things are improving, like we can have that conversation and be like, I'm curious, like what sorts of things you'd want to do. Like, you're here, I can help you do those things. If you're unsure, we can talk about how it might relate to your symptoms. You know what I mean?
Yeah.
So it's kind of like opening that window to like the possibilities. And I find when I ask that question, a lot of people are like more just like, like it'd be cool to be at a place where I could start thinking about, what other things I could pursue.
Yeah.
Because I've been stuck in this box for so long.
Mm-hmm.
Let's get out of that box. That's what I find.
Do you generally find that that's the people's perspective on it, or are there times where they're like, they don't look at it from a positive light and it's like more taken from a negative position?
Yeah, sometimes, if someone just can't entertain the possibility, like I've had that a couple times. Like, I wouldn't say it's the norm.
Yeah.
Like, I think most people are like looking for the ability to have more freedom of choice with their body. But once in a while, I do find that people, if they're just like so
just in a dark place.
Yeah. And entertaining that possibility right now just isn't the right thing. And I think it's good to know that also.
I was going to say, I think that tells you a lot about the situation and the client and where they're at. And I think that's also valuable information that you can use to play off of or consider when going through the process with them and their plan and some of the conversations you might end up having to have or go to when you're getting someone who's responding that way.
Yeah, like you may not be, like we often talk about our 3-step process, like calm it down, build it up, bridge the gap. In that situation, maybe you don't worry about bridge the gap yet, and you're just worrying about how can we improve the state of things, because I think you can re-ask the question when things are improving, and maybe there's a little more openness to like, oh, I can actually start to envision things.
Yeah.
It's almost like, rehab's a mountain and you kind of have to get over the peak in order to like see sometimes.
Yeah.
I don't think that's the case for everybody, but I think that question can give you a lens into the mindset of the person.
Yeah, totally. Yeah, I mean, I would say I use it in a similar fashion, and I tend to get like like very similar responses. The one thing I really like to do, and that I probably take the most away from it when someone is taking it from a positive direction, is I'll immediately just try to implement what they want to be doing if they're magically taking their pain away. Like if they're like, I want to ride my bike, it's like, okay, like how do we do that as soon as possible? And if we could literally do that like tomorrow in some capacity, I think that can be like a game changer. Obviously, if there's like no signs that that's going to enhance their situation, be more harmful to them, etc. But if we can like somehow have them starting to do that as soon as they possibly can, and if it is literally the next day, like that can be a game changer to buy-in in people's, journey, especially if it's like a more chronic pain related thing, or pain is a big factor that's been keeping them from doing stuff. It's a dicey line to play, though. If you do that and then it flares them up even more, then you got some conversation pieces to have. But I think it's more about how you set the expectation around what they're going to do, and that is the possibility, or whatever. As long as you're laying the expectations and setting it up and kind of giving them the information, and I try to get them to do that activity as soon as possible. And then if it's not attainable, because a lot of times it isn't attainable right away, I very much used that particular activity as a reinforcement throughout like the rest of our session. And then when we're talking about, when we're assessing and I'm taking them through objective testing and we're pulling out information, I'm always relating it back to how this can impact them riding their bike and getting back to riding their bike. And I tend to put it in the positive light as much as I can. So like, oh, like that was a great movement, or that was like great strength in this area that will really go a long way to, helping you bike. And then if like there's something that is challenging for them that's they can't do, that's going to help them bike, I'll put it as like this is an area of opportunity to be able to get you to riding your bike as soon as like we can. And then I'll always tie that into like the plan when we're laying out the plan and like where we're going to go. I'll tie it into that as well. So I think it just gives you a lot of ammunition to like lay out things and really drive people towards something that they want.
That's a really good point, and I think I could even take it a step further, where sometimes it's actually the thing that's going to help you get better. I'll give like an example. I've had scenarios where people, let's just say they've gotten kerfuffled from the healthcare system over like a 2-year, 3-year period, and events have transpired which have led them to just stop doing things because they think that's best. Then they get an imaging and it doesn't show anything, and they're like, what the heck is going on? But they want to be back at the gym, like that's what they would be doing. And I'm here to show you that actually this could be the thing that helps you get back, and that it's actually not only okay to be doing that, but is beneficial for your rehab within reason. And what I can do is show you how we can tread that line and use that to our advantage. Like I think that's like sometimes like can open the door to that conversation where you're like, hey, we can do that, and actually we need to do that in order to get this problem solved.
Yeah, and we can do it like now.
Yeah, exactly.
Very, very fast. And like that itself is usually what helps people get out of pain.
Yeah, and you're using the rest of the session to kind of show them more nuance there, and like why that's the case, and like how you can improve their tolerance
and how you can avoid it from happening again, and some of the things that we can help you with to contribute to reducing the risk of this happening again. Like I think that's a big learning piece as well with that, especially if it's something we can get people into right away and they start seeing improvements in their pain and they're starting to do the activity they really like. It's like laying the expectation or laying the foundation of, hey, this is great, like we're moving you in the right direction, you're doing what you want to do, but like let's look at maybe what led you down this path originally, and how do we build you up so that you can reduce the risk of this happening again, and then how do we give you some of the decision making processes and what you do on a daily basis to avoid yourself from running into this problem in the future, so that you don't have to stop riding your bike.
Exactly, and it all comes from that one question, just kind of like exploring where they're at, and you put that together with the rest of your subjective, where you're figuring out more about what the problem actually is and ruling out more serious things and all that good stuff. Mm-hmm. And then you're using the rest of the assessment depending on kind of where that question goes. It could look different, and it can change how you frame your plan. And that's why questions like that are really good, because if it can really guide the rest of your assessment and the plan that you deliver them to show them how you can help them, like that's a valuable question, you know?
Oh, I know.
Doesn't always work like
No.
in many situations, if this is a person who's like really focused on their pain and maybe they have a long history, like that's kind of the use case of this question, right?
More often than not. Like, I don't use it a lot of times when someone's just doing everything they want to
Yeah.
be doing. Like, and we often see a lot of people like that. I saw someone
Yeah.
today in that scenario. Like, they're having wrist pain and they're dealing with it, but they're not. It's not stopping them from doing CrossFit or from working, and it's not even really impacting that. They're able to work around it. So that's a totally different story because like that person's doing everything that they want to be doing. So you're not going to ask that question, or you're going to ask a different question to kind of get things stimulating or head people in the right direction. But yeah, for sure, it definitely is a little bit more strategically placed for that type of person.
And in that scenario, like you want to be that person to plant that seed, and it can be really powerful when it does go successfully. But like, we're just one person, and there's like all kinds of other factors in someone's entire life that are influencing, from their family, from what they read on Google, to the few medical providers they've already seen up to that point, right? So like it's definitely not a shoo-in by any means, but at least it gives you the opportunity to maybe like completely transform somebody's life, right? Like that's what something like that can do.
100%. And we've seen it many cases happen that way.
So there we go. Do you have any other like ways that you would use that, or like stuff that you can get?
No, I think that's good. I think that covers it.
But I think that's like what we tried to like show with these questions is like there's other types of questions and things you could ask, but always thinking like, how can I use questions beyond the basic stuff that you have to ask, right? Like how can I use questions to give me lots of information that could help direct how I approach my assessment and my plan with somebody, and what you're going to communicate to them.
Yeah, and I think it's like continuing to explore questions that you can ask, because I think like a right place question can like completely change the trajectory of a client's outcome. There's times in my life where the right question that I've been asked or that I've asked myself has really helped impact me. So it's the same thing in rehab. It's like there's a ton of times where I've asked questions that go completely flat. They're not good. They don't make any sense. They fail. And I'll eat those. But then there's times where like you hit the right question at the right time and you're like, oh, okay, there's something to this. Like, how can I implement this question more strategically, or how can I word this question a little bit differently so that it gets the most from the client? And like the more you view it that way and the more you start thinking about those things, the better you can lay out and connect the dots for the client. And that's where it becomes like very much the art of the assessment. And I think there's a lot more to the art having an impact than the science. Not to say that the science is not important and that the objective measures aren't important, but the way that you use those objective measures and weave them into the art of asking questions and laying out a session and communicating to a client is the way that you're going to be able to like really, really help people. And that's something that we're continuing to work on, and a big reason why we want to do this series.
Yeah, good questions can like open the door to the opportunity to really explore things together, like you and the client. And like if you ask a good one, it's just kind of like the way to kickstart like a really good conversation that you can both have that's going to move things forward, right? So I think the better you can get at it and the more you can kind of like explore how people respond and how different people respond and what situations might lead you to like asking a certain thing versus another. I think that's, like you said, like the art of, this is how you get to be better, I think, at like the N=1, right?
Mm-hmm.
It's less like, data driven.
Yeah.
Because there's so many scenarios, they can go so many different ways, right?
Yeah. They almost become Yoda like.
I like that.
He dropped a Yoda quote before this podcast, so it made me think of trying to become the Yoda of physio.
Yeah, didn't Nick used to have a series like Jedi?
Oh yeah,
Jedi? That was a
did.
good one.
That was
throwback to that.
Throwback to the old Nick Hanna episodes.
Yeah, I like that.
Now this guy's just doing like these like beautiful philosophical over reads of his reels. You just hear his voice.
Yeah, it's something to behold, you know.
But yeah, that wraps up our question series, guys. We had fun doing this. Let us know what you think about, the series type episodes. Do you like the way that we've laid it out, where we have 5 questions? We, distribute those over the course of 5 weeks. We always have other ideas that we can rock with when it comes to series. So give us that feedback. If you aren't subscribed to the podcast, make sure you subscribe so you don't miss out on any episodes, or so you can go back and check out the other 4 questions that we have in the clinical question series. And then if you want to see our beautiful faces on YouTube, you can subscribe there. We put out the podcast episodes on YouTube. And then if you want to check out our website, head over there. It's themovementmentorship.com. It has all our episodes. It has all things mentorship there. It has a free PDF for you to download on the 3-step plan that's really going to help your client crush. We'd love to chat with you as well. If you're interested in the mentorship, you can sign up for a call there, and we'll talk a little bit more about that and how you can get into the next cohort. But that is all we got for today, guys. As always, stay caffeinated. Peace.